In this video, I'll be looking at my first attempt at Gonio assisted transluminal trabeculoplasty, or GATT. This is a potentially very effective procedure which is also minimally invasive for patients with trabecular causes of open angle glaucoma, such as juvenile glaucoma, pseudoexfoliation glaucoma, and pigment dispersion glaucoma. Because you're addressing the root cause of the problem by bypassing the area of obstruction, you can get really good results. So this was a young 22-year-old patient with juvenile open-angle glaucoma with advanced disease, so I thought that this was a good case for me to get some experience with the procedure. So our first step is to actually create our canalicular probe. Here, melting the tip of a 5-0 proline using a micro cautery, not actually touching the proline, but just coming close enough to melt it to form a mushroom about twice the diameter of the proline itself. We then insert that through an incision at around 4 o'clock, an oblique incision which aims towards the point where you actually want to enter the trabecular meshwork. And then using here I'm using a 27 gauge needle, but you can use a MVR blade. The needle is just a cheaper option. Here I'm going to make a small, about a half to 1 clock hour incision in the trabecular meshwork, and then just open up the posterior lip of that to be sure that we're in Schlemm's canal. Looks like I've got a nice entry there, so we can move on to our next step, which will actually be passing the proline into Schlemm's canal. So to perform this, I'll be using a 23 gauge micro grasper from MST, and we want to take the proline and aim it radially to follow the direction of Schlemm's canal. If you aim it too posteriorly, you could end up in the suprachoroidal space, and too anteriorly, you're going to have a lot of resistance. So here it's entered nicely, luckily, and I feel there's not too much resistance to passing the proline, so I'm going to proceed with 12 passes to aim for 180 degrees of GATT. As far as I understand, 180 degrees has similar efficacy to 360 degrees, but less risk of early post-operative hypotony and reflux hyphema. So I feel that these are going through nicely. I think I actually do 13 here because my first two were a little bit short, and you'll see that this actually takes me around perfectly to the opposite side of the trabecular meshwork. So now that we've done our passes, the next step is to actually retract the proline from the Schlemm's canal following the curvature of the trabecular meshwork so that we get a good shearing through the meshwork. And actually remove the proline. You can see as it curls back, it's all the way up to just under my wound there at around 8-9 o'clock, so that's great. Next, just have a look with the gonio prism to ensure there is some blood reflux, which lets us know that we've opened up the right space, so that looks good. And then the next step is to remove our viscoelastic. Unfortunately here I didn't really follow the instructions. You should actually leave about a third of the anterior chamber full of viscoelastic to ensure good tamponade and prevent blood reflux. Unfortunately I didn't do that, and you'll see the result of that at the end. Then next we need to hydrate the cornea. This is a young patient with very elastic cornea, so I have to do quite an aggressive hydration here. Could potentially have also sutured these wounds, but I felt that I got a good seal following hydration, so I didn't feel that that was necessary. And then we want to leave the pressure at around 30 millimeters of mercury at the end of the case, just to try and prevent blood reflux. But as you can see here, on day 1 I did have a small reflux hyphema. Fortunately, this cleared spontaneously in about a week and didn't cause any problems. This patient actually had a really good outcome. The pressure was down from a baseline of 31 on medication to 8 on day 1, and this has been maintained up until 6 months follow-up. The pressure is still 14 on no medication, so a really great outcome here.